cases are going up both nationally and around the world. France has just ordered, a reclosure and a curfew in Paris and I think 8 other places. And so we're seeing the second surge of this that people said would be coming in the fall. It certainly appears to be coming. We've been talking with our public health officials about these upticks and what things may be causing them and what, if anything, we're going to need to do to make sure that our cases do not spin out of control. Our case count today was 89, but our case count yesterday was 107, and then Tuesday was 121. This trend isn't really a trend because we've seen this on a week-over-week basis. We get some low days and we get some spike days. Our test positivity rate has stayed relatively low at 3.2%, but last week at this time it was 2.9%, so we've had a slight increase and still below the state numbers. But our cases per 100,000 just in the last 7 days ticked over 10. And 10 is the point where you don't want to be. And that, above 10 means that you've gone into, by the CDC standard, high transmissiveness rather than medium transmissiveness. So we're monitoring this very, very closely.
Our cases per 100,000 today is at its highest point since August 2nd. That's multiple months that we've been waiting. We've been trying to get this number down, and it has gone up to that point again. As a reminder, the 10 per 100,000 threshold is the threshold where the multi-state conglomerate, including New York, New Jersey, Connecticut, have typically put out travel advisories related to the states in which they reach that level. And so obviously it is incredibly concerning to us. And, we're not at the point of, alarming. We're in phase 2. We're not moving back yet at this point, but we're obviously continuing to look at those numbers and figure out exactly what we can learn. We are, however, we're preparing an update to our executive order this week that would have allowed for some additional activities. We are putting that on pause while the public health team does investigate this uptick in cases to understand exactly what the cause of the uptick is. There are also considerations that we are making for things like live performances that are now being paused as a result of this uptick in cases, where we need to investigate and find out exactly what the causes are before we feel comfortable moving forward and sending out the potentially mixed messaging that we're seeing an uptick in cases, but we're opening more things up.